Hello and welcome to NewsClick. Ebola is now sweeping through West Africa. More than 1,000 have died and it's said that more than 2,000 have been affected. These are official figures. The actual figures could be much higher. To discuss all this, today we have Dr. Satyajit Rath from National Institute of Immunology. Welcome, Satyajit. Now, Ebola has been known to be dangerous. It has been declared now an epidemic by WHO of serious concern and so on. Do you think it has chances of becoming a pandemic in Africa?
Clearly, it's a major outbreak. Think about it this way. Regardless of whether we have always learnt about every case of Ebola or not, all said and done, this is in interior Africa and rural Africa, forest-associated communities, from where reporting also may be somewhat underreported. Yet, since the mid-70s, when Ebola was first identified, until last year, I don't think our recorded deaths due to Ebola have been as many as in the last 6 months. So clearly, what is happening today is unusual, despite all caveats. How far is this going to spread? Equally clearly, it's spreading. Even though it started from contiguous border, close to border areas, so it's not surprising that it's spread between 1 and 2 countries. But it's now spread to Nigeria, where while there have not been large numbers of deaths, some deaths have been reported from Nigeria. So it is spreading. That said, the transmission of Ebola is, like many other things about Ebola, something of mystery. We know that body secretions, exposure to body secretions is associated with infection. But it doesn't seem to be as easy to catch Ebola, for example, as perhaps it is to catch influenza. There isn't good evidence, maybe this is just lack of knowledge, but there doesn't seem to be good evidence that Ebola is, for example, transmitted by coughing or sneezing. Some more close contact of some sort with body fluids needs to be required. Why is this so? What is the mechanism is all unclear. And as a result, it's possible epidemiologically to build models in which transmission, if it's not really easy, then the cultural responses of human communities in containment will tend to trump transmission and will lead to cessation of outbreaks before they become widespread. On the other hand, in sort of scaremongering terms, it's perfectly possible to make the other argument, which is that so many people are dying, they've never died before, maybe this is a strain of Ebola that we haven't seen before, and maybe it's going to spread. The rate of spread doesn't seem to support scaremongering even in the 4 affected countries so far. But this is a general problem with emerging infections constantly. We may hit tomorrow a virus that we have no experience of, and it may spread like wildfire amongst us and may kill half of us. It's possible. But Ebola has cousins. Marburg virus, for example, is a cousin of Ebola. There are other Ebola relatives in sub-Saharan Africa.
One part is that while, as you said, other countries have had Ebola earlier, these 3 countries have not seen Ebola outbreaks before. You think that's one of the reasons that it took longer to catch it, that they didn't recognize Ebola and that's why it did spread before it could be caught?
Sporadic enough that even in communities in Zaire, in Congo, for example, where the first cases occurred, in fact, along the Ebola river, which is why it's called Ebola virus, these are areas where there are so many causes of hemorrhagic fevers that diagnosing Ebola has never been easy or straightforward. So while in formal terms it's possible, I would be surprised if that's a major contributor to catching it late, as it were. I think it's simply an outbreak in somewhat more populous areas than many of the previous outbreaks, which have been in really small forest-associated communities, and spread has happened.
Do you think also the fact that these countries concerned, their health systems are not strong, is one of the reasons that it has spread in this form?
I'm going to make a specific response and a general response, and they might seem at odds with each other, which I'm going to argue they're not. The specific response is I don't think so, because neither in the Congo nor in a couple of other countries in the region where outbreaks have occurred in the past 35 years, has there been this level of spread. And we would be fooling ourselves if we thought that the public healthcare delivery systems in those countries were or are better than in the current countries that are affected. On the other hand, I can make a more general argument, which is it that these kinds of outbreaks, when they occur in countries where the public healthcare delivery system is poor, have a much higher chance of spreading? Absolutely yes. And that, I think, is an absolutely important point for us, that even this outbreak, if the public healthcare systems had been better, if economic situations had been better, if education levels had been better, if communities had been better off, not simply in financial terms, but in everything that makes us human communities, containment would have been far faster.
If we look at disease in general, then Ebola, Marburg viruses are all known to be extremely dangerous. Why is the public health system not developed medicines for or vaccines for this kind of diseases?
The two issues that I think we should keep in mind. Number one, developing antiviral drugs has always been difficult. Despite all the efforts put into influenza viruses, for example, there are not that many Tamiflu cousins out there. So there is a scientific technological problem that we need to keep in mind. But there is a deeper and more techno-economic system related underlying issue, which is the publicly funded research systems create knowledge, but the systematic exploitation of that knowledge to make a technology, to optimize it with small incremental tweaks as engineers optimize technologies, and to test it rigorously in regulatory appropriate terms and to put it out there so that it's available. Today, globally, including over the past years in India, which for a while stood apart from it, has been by common consent given over to the profit-making pharmaceutical sector. And this is not to call the pharmaceutical sector names. All said and done, the whole point of a company is to make profit. They will, of course, make their calculations, and their calculations are very straightforward. If we can develop a drug on something, on some condition that is fairly widespread, or at least that we can persuade people that it is fairly widespread, that is widespread amongst people who can afford to pay high prices, and that will not lead to cure but only to amelioration, so that they would need to take it for a long time, if not for the rest of their lives. That's profit. The logic of the capitalist marketplace departs from the public interest, and where states must intervene far more emphatically and far more effectively.
It's interesting what you say, because as you know, WHO and UNICEF together have paid a huge amount of money so that the big pharma can produce vaccines, because vaccines are not by definition profitable because they prevent disease, and the money that a pharmaceutical company makes is from disease rather than preventing it. So this is the logic of the system that operates, which seems to show that the public health system in that sense cannot be driven by profit. So there has to be some other driver in order to stop these diseases, and strangely enough they are called neglected diseases. Well, it's a neglected people, isn't it?
I will only add one caveat to that. And that caveat is that delivery of available, tried and tested public health measures, including but not restricted to drugs and vaccines, is one component. Development, testing and making available new interventions is a separate issue. The first, even today, we sort of acknowledge state responsibility for the first component. For the second component, we only acknowledge state responsibility reluctantly, and even that for what I am calling the upstream component of discovering targets. We leave the downstream increasingly, and by now completely, to the profit-making sector. And I think that in and of itself is certainly not working and needs to change.
Thank you very much, Satyajit. We'll keep on watching what happens over the next few months, because I don't think Ebola, this particular outbreak, is going to go away soon. And we'll also follow up what is the change in policies with respect to such diseases, because I think this is a very significant warning to the health systems of the world, and we need to follow up on what this is going to do to it. Thank you very much.